everyone, so let's move towards our today's topic, which is
Fascia transversalis. Okay, now fascia transversalis is basically fascia. As we know that the anti-abdominal wall is consists of some layers. First of all, skin, then after skin, superficial fascia, then deep membranous fascia, then muscles, rectus sheet, and then fascia transversalis is present. Now fascia transversalis, what is the function? Fascia transversalis basically separates the peritoneum. Okay, it separates the peritoneum and the layers of the anti-abdominal wall, or the muscles of the anti-abdominal wall. Okay, so the muscles of the anti-abdominal wall and the peritoneum is separated by fascia transversalis. Okay, now the boundaries. Okay, anteriorly, obviously, linea alba is present. It is attached with the linea alba. Posteriorly, thoracolumbar fascia is present. Superiorly, diaphragm fascia is present. Diaphragmatic fascia is present. And inferiorly, hip bone is present. So basically, the whole anterior wall of the abdomen below the muscle, the fascia is called as fascia transversalis. And one more point which is very important, and which will help you a lot in the topic of inguinal canal, that is that mid-inguinal point. What is mid-inguinal point? An imaginary line. Okay, as you know that hip bone and the parts of hip bone, anterior iliac spine and the pubic tubercle. So between the anterior iliac spine and the pubic tubercle, draw an imaginary line. Draw a line, and between that line, the midpoint of the line is called as mid-inguinal point. So that mid-inguinal point consists of an oval opening which is present in the fascia transversalis, and that oval opening is called as deep inguinal ring. Okay, and what are the contents of the deep inguinal? Why deep inguinal ring is present, I will tell you in the lecture of the inguinal canal. But what are the contents? Contents are basically spermatic cord in males, and in females round ligament is present. So this was the whole topic regarding fascia transversalis. Till then, work hard, study hard, and good luck. Take care. Bye bye. Thank you.